Carter Carter 30, 13. Carter 13. The overseas doctors. The overseas doctor. Type of registration. To main and trade patients in the UK, although all doctors must register with, with the General Medical Council. There are several types of the registration. Provisional registration is for doctors who have just qualified from medical school in the UK or from certain European Economic Area member states. For registration is for doctors who have completed their years clinical training. Limited registration is there for international medical graduates who have not completed the equivalent of the year clinical training in the UK. Specialist registration is for doctors who have completed specialist medical training and have a certificate of completion of training. The GP register is a register of all those eligible to work in general practice in the NHS. Um, for further details of the General Medical Council, see www.jimmyc.uk.org. PLAP. Before they can obtain full registration, some categories of overseas doctors are required to take the Professional and Language Assessment Board (PLAB) test. The Professional and Language Assessment Board is designed to ensure those who pass can practice safely and the level of an HO in a first appointment in a UK hospital. Part 1 consists of the written test of knowledge, skill and attitudes. Part 2 is an objective structured clinical examination (OACE). It consists of the 17 5-minute clinical scenarios known as stations to assess professional skills. Plan station, uh, PLAB stations, and advice. OACs aces the skills. Clinical examination, your ability to carry out a physical examination of and simulate patients, and actors trained to play this role will be assessed. Uncomfortable, uncomfortable or intimate examination will be carried out using a mannequin and anatomical model. Practice practical skills. You will be assessed on practical skills such as suturing and giving intravenous injection. Communication skills. your ability to interact with and simulate patients, or in some case, the examiner will be assessment. Skills tests may include breaking bad news and giving advice on lifestyles. History taking, your ability to take an accurate history and make a reasonable diagnosis will be assessed and based on the station from successful candidate. Read, read the instruction on site a station careful food. You have a 1 minute for this. Don't don't forget the ABC airways, bracing and circulation protocol in very emergency station. Keep in mind safety precautions like throwing the sharp in the trash bin. Check the patients understand with what is happening, then them ask them about any concern they may have. Don't just given a lectures. Listen carefully the one the actor say. Sharps are the needles and blades which must be disposed of safely in a special container called a shepherd's bin. En español sería: el médico extranjero, que hay tipos de registros para administrar el tratamiento y para administrar y tratar pacientes en el Reino Unido. Todos los médicos deben registrarse en el registro general, consejo médico, consejo médico. Am, Hay varios tipos de registro. El registro provisional, que es para médicos que acaban de graduarse de la Escuela de Medicina en el Reino Unido o de ciertos estados, miembros del Espacio Económico Europeo. La inscripción completa es para médicos que hayan completado la capacitación clínica de su año. El registro limitado es para internacional, inter- internacional graduados médicos que no han completado international, sí, internacionales graduados médicos que no han completado el equivalente un año de formación clínica en el Reino Unido. El registro de especialistas es para médicos que han completado capacitación médica especializada y tener un certificado de finalización de la capacitación. El registro de médicos de cabecera es un registro de todos aquellos elegibles para trabajar en la práctica general en el NHS. El PLAB, antes que puedan obtener el registro completo, se requieren algunas categorías de médicos en el extranjero para realizar el examen de consejo de evaluaciones profesionales y lingüísticas, que es PLAB. El PLAB está diseñado para garantizar que aquellos que aprueben pueden practicar de manera segura al nivel de un SHO en una primera cita en un hospital de Reino Unido. La parte 1 consiste en una prueba escrita de conocimiento, habilidades y actitudes. La parte 2 es un objetivo examen clínico estructurado. Consta de 16 escenarios clínicos de 5 minutos, conocido como estaciones para evaluar las competencias profesionales. Am, las estaciones, sí, las estaciones PLAB y asesoramientos. Las OSCE evalúan estas habilidades del examen clínico y su capacidad para llevar a cabo un examen físico de un simulado. Se evaluará al paciente, un actor capacitado para desempeñar este papel. En incómodo o íntimo, los exámenes se llevarán a cabo utilizando un maniquí o modelo anatómico. Habilidades prácticas. Evaluará en habilidades prácticas como suturas y dar inyecciones intravenosas. Habilidades de comunicación. Su capacidad para interactuar con un paciente simulado o en algunos casos el examinador será evaluado. Las habilidades evaluadas pueden incluir dar malas noticias y dar consejos sobre estilo de vida. Toma de antecedentes. Su capacidad para tomar un historial preciso y hacer un diagnóstico razonado será evaluado. Asesoramiento sobre asesoramientos sobre las estaciones de un candidato seleccionado. Lea las instrucciones fuera de cada estación con cuidado y tiene un minuto para esto. No olvides el ABC, vías respiratorias, respiración y protocolo de circulación en cada estación de emergencia. Ten en cuenta las preocupaciones de seguridad, como tirar los objetos punzantes en él y el contenedor de objetos punzocortantes. Verifique que el paciente atienda a lo que está sucediendo, entonces pregunte sobre cualquier inquietud que pueda tener. No solo da una conferencia, no solo dando una conferencia, sino que escuchar atentamente lo que dice el actor. Los objetos punzocortantes son agujas y cuchillas que deben desecharse de manera segura en un recipiente especial llamado contenedor de objetos punzantes. Exercise 13, exercise 14. What kind, what kind of registration might this doctor obtain? A newly qualified Spanish doctor, provisional registration. A newly qualified uh, Nigerian doctor, limited registration. And a doctor who was successfully complete the first foundation year for registration. And HO was successfully complete the foundation program and gaining a certificate, no, certificate of completion of training after several specialist register post specialist registration. What the abbreviation in Word? Any doctor who wants to work in the UK must register with the GMC, General Medical Council. Some overseas doctors must pass the PLAB test before they can register. Professional and Linguistic Assessment Board. Part 2 of the test consists of an OACE, Objective Structure Clinical Examination. In any emergency, remember the ABC protocol: airways, breathing, and circulation protocol. Before you can obtain specialist registration, you must have an CCT certificate of completion of training. Complete the test. My name is Musa. I'm and I come from Yemen. I came to UK about 2 year 2 year age 2 year age. After the graduate, well, after graduating, because Jamie is outside the EEA, he only obtain limit registration with the GMC at first. It was very difficult for me to attain place on foundation program. Although speak although speak good English, I had to take the PLAB test to show that is a good work safely in the UK. If I had to give some advice to other candidate, it would be that at counseling station you should simple simple memorize memorize a set of phrases. It's better to really think about what you saying to the actors and get the intonation right. Get in intonation right. After completing my year clinical training, I was able to obtain full registration, but found it difficult to get and show post in my chosen specialty, pediatrics. As hospital now have to demonstrate there is a suitable candidate from the AAR. Once I be complete my second foundation year, it should obtain CCT, which will allow me to proceed to specialist registration with the GMC, an important step important step on the road to becoming a pediatric consultant.